So what is Medicare Part B? I'll explain what it is next in a minute with Marty, so stay tuned. So what is Medicare Part B? It is your outpatient medical coverage for medically necessary healthcare services. So what does this Part B cover? Think of Medicare Part B coverage as any care administered by a physician. Part B is optional, but if Medicare is your primary coverage, you definitely need Part B. You also cannot get Medigap supplemental coverage without it. So it's a very important piece of your Medicare care to have Part A, Part B, as we will discuss that today. So what does Medicare Part B cover? Medicare Part B covers preventive care like flu shots, colonoscopies, mammograms, and all sorts of preventive services. It covers ordinary outpatient things like doctor's visits, lab testing, home health care, ambulance rides, and some chiropractic care as well. Medicare Part B also covers services that sometimes occur in the hospital, things like physician services, radiation or chemotherapy for cancer, some surgeries, and diagnostic imaging. It also covers drugs that are administered in a clinical setting, such as osteoporosis injections and insulin that is used in an insulin pump. In most cases, outpatient prescription drugs will fall under your Part D coverage, which we will cover in a separate video. Part B pays 80% of approved Medicare cost after you first pay your annual deductible. Is there a cost for Medicare Part B? Again, as in our previous videos, we'll tell you that Medicare is not free. Your Part B cost is based on your income. We provide yearly updates to Part B premiums in our Learning Hub on our website, which is hfcbenefits.com. If you are in a higher income bracket, be prepared to pay more, but most Americans roughly pay the same each and every month. Medicare will deduct your Part B premiums out of your Social Security check if you are already enrolled in your Social Security income benefits. If not, they will bill you quarterly. There is a credit card option at the bottom of the quarterly invoices as well. When do I enroll in Medicare Part B? Just like Part A, people who are already taking Social Security income benefits at the age of 65 do not need to enroll. The Social Security office will automatically enroll you. For everyone else, you need to apply for Medicare Part B themselves at age 65. Applying for Medicare Part B can be done online, over the phone, and in person at the Social Security office. After you apply, it'll take about 2 to 3 weeks before your card will arrive. So you should plan to apply several weeks prior to when you need that coverage. It is important to enroll in Part B during your initial enrollment period, unless you have other credible coverage. An example of other credible coverage is an employer-sponsored plan. If you enroll late in the Part B, you may also have to pay a penalty for life. So it's important not to miss your enrollment window whenever you retire and lose access to your employer health insurance. If you failed to sign up for Medicare when you were first eligible and you didn't have credible coverage, again, employer coverage, you'll be subject to the Medicare Part B late enrollment penalty. And this penalty is equal to 10% per year for every year that you waited to enroll. And this is a lifelong penalty. So that's why it's important to stay on top of things and use an insurance agent whose specialty is in Medicare to help you in this process. And especially if you have questions, we are more than happy to help you do that. When you missed your initial enrollment period for Part B, you'll need to wait to the Medicare general enrollment period to sign up for Part B. And this period runs from January the 1st to March 31st of every year. Your benefits will then begin the following July, so it's not immediately. This can be a double whammy because not only do you now owe a penalty, but you have to wait several months for your coverage to kick in. So it's very important to stay on top of these things. The best way to avoid Medicare Part B late enrollment penalty is to enroll in Medicare during, again, your initial enrollment period. What is my Medicare cost sharing under Part B? Again, we continue to emphasize that Medicare is not free. You'll pay a percentage of the cost of your medically necessary Part B services. In most cases, those costs are, you'll have an annual Part B deductible. And again, that changes. 20% of the remaining costs, there's no limit or a cap on that 20%. And any excess charges that a provider or a facility may charge beyond what Medicare reimburses. So the most important thing to keep in mind is the 20% you owe for outpatient medical care. For services like the surgeries or chemotherapy, your expenses can add up to thousands of dollars. It can add up quickly. And in order to lower those overall costs and those liabilities, there are supplemental coverages options that are available for you on any budget. And that's another video we'll have available too, talking about Medicare supplements. So you definitely, when it's time to retire, you want to sit down with someone to plan ahead of time, and so you can come up with a plan that is financially viable for you and your family. Again, this was a very brief introduction into Medicare Part B. Make sure you watch all our other videos listed on our YouTube channel, or visit our Learning Hub at hfcbenefits.com that will explain in better detail each part of Medicare. If you've enjoyed this video, please hit the like button on the bottom of this video. It'll help other people find this important information. Again, I hope this was beneficial to you today, because this was a Minute with Marty. Have a good day.